Are you tired of dealing with the symptoms of an enlarged prostate? In this video, know the signs and get the relief you need. Treating an enlarged prostate is easier than you think. Keep watching this video to learn more. Enlarged prostate. Glands responsible for producing the fluid that delivers sperm. During ejaculation is the prostate. The urethra, the tube via which urine exits the body, is encircled by the prostate gland. The gland has expanded if the prostate is enlarged. Almost all men have prostate enlargement as they age. BPH, or benign prostatic hyperplasia, is a common name for an enlarged prostate. It is not cancer, and it lowers your risk of developing prostate cancer. Other names for BPH include benign prostatic hyperplasia hypertrophy, enlarged prostate. Causes. It is unclear what causes true prostate enlargement. The development of the gland and testosterone levels may be influenced by aging-related factors and changes in the testicular cells. BPH does not occur in men who had their testicles removed when they were young, for instance, due to testicular cancer. Additionally, the prostate starts to get smaller if the testicles are taken out after a man develops BPH. This is not, however, a typical course of treatment for an enlarged prostate. Symptoms. Only around half of men with BPH experience symptoms. Dribbling at the end of urination. Inability to urinate, urinary retention, incomplete bladder emptying, incontinence, needing to urinate twice or more during the night, pain when urinating, or bloody urine, both of which may indicate infection. A slowed or delayed start to the urinary stream, straining to urinate. A strong and sudden urge to urinate, and a weak urine stream are examples of symptoms. Tests and exams to feel the prostate gland. A digital rectal exam will also be performed. Other examinations might include urine flow rate, a test to measure the amount of urine still in your bladder after urinating. Urinalysis, to check for blood or infection. Urine culture, to check for infection. Tests to screen for prostate cancer: cystoscopy, blood urea nitrogen bun, and creatinine tests. Blood urea nitrogen bun and creatinine tests. Treatment. Your preferred course of treatment will depend on how severe your symptoms are and how much they annoy you. Your healthcare professional will also consider any further medical issues you could have. Watchful waiting, dietary modifications, medication, or surgery are all possible treatments. You are more prone to get symptoms if you are over 60. However, a lot of men with enlarged prostates only have mild symptoms. A yearly assessment is recommended if you have BPH in order to track your symptoms and determine whether your treatment needs to be modified. Self-care. When you initially feel the urge to urinate, do so for mild symptoms. Additionally, even if you don't feel the urge to urinate, go to the restroom on a regular basis. Avoid caffeine and alcohol, especially after dinner. Don't ingest a lot of liquid at once. Avoid consuming liquids 2 hours before bedtime. Try not to take over-the-counter cold and sinus medicines that contain decongestants or antihistamines. These drugs can increase BPH symptoms. Medicines, a class of medications known as alpha-1 blockers, is also used to treat high blood pressure. These drugs ease the bladder, neck, and prostate muscles. This makes urinating easier. Most persons taking alpha-1 blockers have symptom alleviation within 3 to 7 days after starting the medication. The amounts of hormones the prostate produces are reduced by finasteride and dutasteride. These medications also raise urine flow rate, alleviate BPH symptoms, and diminish gland size. Prior to noticing any improvement in your symptoms, you may need to take these medications for 3 to 6 months. Impotence and a decline in sex desire are potential side effects. Saw palmetto for the treatment of an enlarged prostate. Many herbs have been explored. To relieve discomfort, many men utilize saw palmetto. It may help with symptoms, according to some studies, but the evidence is conflicting and additional study is required. Surgery. Prostate surgery may be advised if you have any of the following: incontinence, recurring blood in the urine, urinary retention, recurrent urinary tract infections, declining kidney function, bladder stones, or bothersome symptoms that don't go away with medication. the degree to which your symptoms are present as well as the size and shape of your prostate gland will usually determine which surgical technique is advised. The most popular and effective surgical treatment for BPH is transurethral resection of the prostate TURP. The prostate is piece by piece removed during TURP by introducing a scope through the penis. The inside of the prostate gland is removed during a simple prostatectomy. Your lower belly is surgically sliced to make the incision. Men with really big prostate glands are the ones who receive this treatment the most frequently. To eliminate prostate tissue, some less intrusive techniques use heat or a laser. Another less invasive method involves tacking the prostate open, which leaves no tissue behind. None have been demonstrated to be superior to TURP. After 5 or 10 years, those who undergo these treatments are more likely to require surgery once more. These procedures, however, might be an option for younger males, while the danger with TURP is not extremely significant. Many of the less invasive procedures carry a lower risk for impotence and incontinence than TURP. Older individuals, men who use blood thinners, men who are at an elevated surgical risk, men with severe medical illnesses, such as uncontrolled diabetes, cirrhosis, alcoholism, psychosis, and major lung, kidney, or cardiac disease. Long-term BPH sufferers may experience the following symptoms: sudden inability to urinate, urinary tract infections, urinary stones, kidney damage, blood in the urine. Even after surgery, BPH may recur in the future.
Thank you for watching my video. Subscribe to get regular updates on my channel.